Okay, so here I told you we are going to talk about the blood gas analysis. Means if your patient condition is so bad, especially the respiratory acidosis or alkalosis or metabolic acidosis or alkalosis, right? So our first priority to check the arterial blood gas, arterial blood gas. So in NCLEX board or when you practice as an RN or as a doctor in the hospital, or maybe question come, let me explain according to the American style, because maybe I started my job in Barbados hospital, but here in America, the system is different. Doctor do not collect the blood for arterial blood gas analysis. RN do not collect the blood for blood gas analysis. Question come, who can collect the blood for blood gas analysis, right? So in especially the respiratory therapist or the person who is very skilled, they can collect the blood for blood gas analysis. But usually arterial blood gas is shortly called ABG. This procedure usually performed by respiratory therapist. What is the important? We have to know, I said, before like a patient waiting to give his blood for arterial blood gas analysis, before to collect the blood, we have to perform a test, and this test is called Allen test. Allen test, right? Let me recap it for you. I said when a patient need to blood gas analysis, before to collect the blood, we have to perform Allen test. So Allen test prior to the puncture of the blood. If you ask me why we have to do the Allen test, to see the redness or blood flow. So just explain 2 or 3 questions what NCLEX board asks. Like question number 1, where are the most sample draw from the blood for Allen test? We have to collect the blood usually from radial artery in the wrist, radial artery in the wrist joint, right? This is the wrist joint. We can collect the blood from radial artery, right? So what we have to do for the Allen test, we tell the patient close and open the hand, right? Close and open as quickly possible, squeezing. So after that, we have to press in the radial and ulnar artery simultaneously. So after that, we have to hold it 5 minutes. So sometimes NCLEX board asks, how long should pressure be applied to the site after collecting a sample? 5 minutes. And which test, I said board question sometimes asked, which test should be performed before collecting the arterial blood gas analysis? Allen test, right? So Allen test, when we do, tell the patient open and close the hand, right? Then we have to pressure radial and ulnar artery. After 15 seconds, we have to remove the pressure and check how long take time to rebag the blood, reposition the blood. So hand is open and pressure is released from ulnar artery. Color should return within 15 seconds to see the circulation is good or bad. So Allen test is done to assess the arterial blood flow to the hand. When we see the blood is returned back within short time, it means blood circulation is so good. Respiratory therapist or RN, who is very specialized for collecting the blood, they can collect the blood from this hand, right? So here the test can be performed for either ulnar or radial arteries, right? And this is the very important Allen test we have to done before blood collect from the radial or ulnar artery. So just I want to recap again. When we put the pressure in radius and ulnar artery, hold direct pressure over the side for at least 5 minutes and or 20 minutes if patient is anticoagulant. So don't miss it. Yeah, maybe it make you confusion a little bit here. Collect 15 minutes you has to pressure during the Allen test. But when the therapist or RN collect the blood, right, the needle is pushing, collect and needle is withdraw. After needle withdraw, the person can hold the pressure over the side at least 5 minutes, means stoppage the bleeding, or 20 minutes if patient on anticoagulant, right? So also keep in mind, if any ear embolism suspected, place the patient on left side or Tendelberg position, right? So now go back in the main portion for the day, and this is normal blood gas analysis, shortly called ABG. So normal blood gas analysis, when we do, we can see the pH level, the partial pressure of carbon dioxide, and also bicarbonate ion. So in blood gas analysis, basically the major component, all are major component, but for acidosis or alkalosis, or I mean respiratory or metabolic acidosis or alkalosis, we need three major component. One is pH, other is the carbon dioxide. It is called PA carbon dioxide. PA means partial pressure of carbon dioxide, or bicarbonate ion. These three is important component to acid-base measurement, the acid-base imbalance. But saturation of oxygen also you can see by blood gas analysis, which is the most important to see the patient condition. Usually the saturation of oxygen should be more than 95%. More than 95%. It means patient are getting better oxygen. If the saturation of oxygen is less than 95 or 94%, they need oxygen. Or we can check the saturation of oxygen by oxymetry device. In case of COPD patient, the saturation of oxygen is less than 91%, sometimes normal, right? I'm going to focus in the three major component pH, partial pressure of carbon dioxide and bicarbonate ion to explain the acid base imbalance. So out of these three, our main focus in the pH, right? So pH normal range is 7.35 to 7.45. This is the normal pH. pH stands for hydrogen ion concentration. I'm not going to discuss too much because what is necessary for the board exam, I'm going to give the focus up there. But also some of the student is very curious for them. I said this is the pH normal range 7.35 to 45. So it is the neutral condition. Neutral. When pH is this level or this range, your enzyme system work very well and body continue the chemical reaction in metabolism system. If the pH is not within this range, enzyme does not work. If enzyme does not work, the no chemical reaction take place. If no chemical reaction take place, no metabolism at all. If no metabolism, no ATP production. If no ATP production, you will die, right? ATP is the source of the energy in the body. So this is the important. We have to keep the pH always within the normal range. But when anybody is undergo the disease process, the pH getting imbalance. When pH get imbalance, chemical reaction will be hampered. But our body try to compensate by changing carbon dioxide or bicarbonate ion. So pH is one of the most important marker for acidosis or alkalosis, right? And then what are the second one? Second one is the partial pressure of oxygen. It is 80 to 100 millimole per liter. Some book mentioned it is 100 to 80 to 100 millimeter of mercury. The partial pressure of carbon dioxide is 35 to 45 millimole per liter, but some book mention millimeter of mercury, right? So, and bicarbonate ion 22 to 26 millimole per liter, but some books said 21 to 28 milliequivalent per liter, right? So as I told you, the three major component is important for understanding acid-base balance. I'm going to go back up there first. So here I told you when we can see the pH, right, 7.35 to 45, the rule number one, if the pH is less than 7.35, because in NCLEX board, if it is too hard, sometimes give you the number, pH give a number, carbon dioxide give a number, and bicarbonate ion. Keep it mind, keep it mind. pH when less than 7.35, this is always acidic. If the pH is more than 7.45, it is alkaline. So like A, B, C, and D, A, respiratory acidosis, B, respiratory alkalosis, C, respiratory acidosis, sorry, metabolic acidosis, and D, metabolic alkalosis. Just see the pH range. There are 4, you can make 2, right? There are 4 options, but only see the pH range, you can figure it out. The answer is metabolic or respiratory, or acidosis or alkalosis. So I said if pH is 7.35, less than this, acidic. If pH is more than 7.45, this is alkaline. Like problem number 1, showing that pH is 7.20. Is it less than 7.35, right? As I told, if it's 7.20, means less than 7.35, they should be acidic. Problem should be acidic. Either respiratory acidosis or metabolic acidosis. At least out of 4, we make it shorter. Now question come, is it respiratory acidosis or metabolic alkalosis? Now question number 2, pH is showing 7.50. It is more than 7.45, so the problem must be alkalosis, basic or alkalosis. So out of 4, the question number 2, alkalosis problem, either respiratory alkalosis or metabolic alkalosis. So I'm talking about the pH is the marker. Out of 4, we can make it 2, either acidosis or alkalosis. When less than 7.35, acidosis. When more than 7.45, alkalosis. Question number 3, it is showing 7.30. Definitely it is less than 7.35, and this is acidosis. Now go for the question, second one, and this one is the carbon dioxide. Rule number 2, carbon dioxide is a marker for respiratory. When carbon dioxide is abnormal, means problem in respiratory problem, right? So carbon dioxide is a marker of respiratory problem. And bicarbonate ion, CO3, is a marker for metabolic problem, right? Now question come, if like in case of respiratory acidosis, right? The carbon dioxide, respiratory, carbon dioxide is a marker, right? Respiratory. In case of acidosis, pH is less than 7.35, and carbon dioxide should be more than upper range, more than 45. In case of here, carbon dioxide we are talking about right now, respiratory. Carbon dioxide in alkalosis, pH definitely more than 7.45, but carbon dioxide should be less than 35. In case of metabolic acidosis, metabolic is a bicarbonate ion, right? It is easy to remember. Metabolic acidosis, pH less than 7.35, but bicarbonate ion, who is a marker of metabolism, they also less than 22. So metabolic acidosis, pH is less than normal, and bicarbonate ion less than normal. But metabolic alkalosis, pH is more than 7.45, and bicarbonate is more than 26 is the upper limit. So some student like this, the ROME method, ROME, means metabolic, R for respiratory, okay, O stand for opposite, and M stand for metabolic, and E stand for equal, okay. So it stands for equal. So here I'm saying in case of like Rome, Rome is the capital of Italy. So me is very special, right? Me is special. I need my license because I'm working so hard. I am to be the special. So me, M for metabolic, and metabolic is equal. What does it mean? Metabolic, in case of metabolic acidosis, pH is less than 7.35 and carbon dioxide is less than 22. Both are less, right? pH and bicarbonate both are less. Metabolic alkalosis pH is more than 7.45 and bicarbonate ion is more than 26. And this is called means metabolism is equal with pH and carbon dioxide. I want to recap something. The pH is a most important component to distinguish between acidosis or alkalosis, right? And when pH is less than 7.35, acidosis. When pH is more than 7.45, alkalosis. And carbon dioxide is the marker or indicator for respiratory problem. If you see the carbon dioxide not within this normal range, means the problem is respiratory. And bicarbonate ion is the marker of metabolic. So when you see the carbon dioxide is not within the normal range, then you can see metabolic problem, right? So in NCLEX board question, there are 3 numbers. One number must be the normal range. Which one is a normal range? pH is always either less or more. But out of carbon dioxide and bicarbonate ion, any one should be normal, another one should be abnormal. Which one is abnormal? That one is a problem. I said when carbon dioxide problem means respiratory abnormalities. When bicarbonate ion is not normal, this is called metabolic problem. Okay, so this is the way we have to uh, find it out about the question. Like here, some example question, problem number 1. So pH is 7.20, less than normal, right? Less than normal means acidosis. What about the carbon dioxide? Carbon dioxide is a respiratory marker, right? And it is more than, upper range. Upper is 45 and 64. So pH is less, carbon dioxide is more than upper range. And this is respiratory acidosis, where the pH is less than normal and carbon dioxide is more than upper range, upper number, and it is respiratory acidosis. Problem number 2, pH is 7.50. It is alkalosis problem because the pH is more than 7.45. Carbon dioxide is 35. So there's a normal range. So we're not headache about the normal. And bicarbonate is abnormal. And we said bicarbonate is a marker of metabolic problem. And bicarbonate increase. So pH increase, bicarbonate increase. So it is the Rome method. Means metabolic is equal. pH increase, bicarbonate increase. So here pH is more than normal, bicarbonate is more than normal, and this is metabolic alkalosis. Problem number 3, the pH is 7.30. It is less than normal, means acidosis problem. Carbon dioxide is 38. It is within the normal range. So we are not thinking about this. Bicarbonate ion is 18. means less than normal. It is 22. So both are less. What is the both are less? Here, metabolic acidosis, less pH is less than normal, and bicarbonate ion is less than normal, and this is metabolic acidosis. Metabolic acidosis. So as I told you, there are 3 points you have to remember. I want to recap it again. The pH is a marker to distinguish acidosis or alkalosis. When pH is less than 7.35, it is acidosis. When pH is more than 7.45, alkalosis. And carbon dioxide is a marker of respiratory problem. And bicarbonate ion is a marker of metabolic problem. So this is the way we have to find out what are the problem basically. So now second question, sometime we have to ask or we should know that not it is the if the question come like this type of 3 numbers, but you have to memorize something more about this, like as example respiratory acidosis, like respiratory acidosis, keep in mind, if patient has an acute lung condition, if patient acute lung condition that is interfere the alveoli gas exchange, patient has a respiratory acidosis problem, any kind of lung disease like pneumonia or acute pulmonary edema or aspiration of foreign body or chronic lungs disease like asthma or cystic fibrosis or emphysema, any kind of lung disease, respiratory acidosis, right? Usually, if the patient has respiratory acidosis, patient present with increase the pulse rate, increase the respiratory rate, or patient complain of headache, dizziness, confusion, decrease the level of consciousness, or patient develop the hyperkalemia, weakness. Respiratory alkalosis, basically, if the patient has a hyperventilation due to extremely anxiety patient or elevated the body temperature, or if the patient's hypoxia means oxygen level is go down, or any kind of salicylic overdose, that case respiratory alkalosis. Make it easy for NCLEX board. As I told you, any kind of lungs disease, pneumonia, pulmonary edema, aspiration of foreign body, chronic lung disease, asthma, then COPD, cystic fibrosis, emphysema, respiratory acidosis. Only hyperventilation condition, respiratory alkalosis. Metabolic acidosis, more common in case of renal patient. If patient is a renal failure, if patient is a diabetic mellitus, okay, or if patient has a diarrhea, metabolic acidosis. The patient who have the metabolic acidosis usually present with the, sign symptom. Patient has a lethargy or confusion or weakness, nausea, vomiting, hyperkalemia. Hyperkalemia also common in respiratory acidosis, hyperkalemia. The NCLEX board asks a question about the metabolic acidosis. What type of respiration metabolic acidosis problematic patient? Their respiration is rapid and deep respiration, and that is called Kussmaul respiration. Kussmaul respiration. Metabolic alkalosis, basically, if any excessive acid loss through the gastrointestinal tract, like diarrhea, like vomiting. So I said if excessive fluid loss through the mouth, vomiting, alkalosis. If excessive fluid loss through the ending part of gastrointestinal tract like anus, diarrhea, patient has a metabolic acidosis. What are the other cause of metabolic alkalosis? Like gastric suctioning, excessive use of potassium wasting diuretics like Lasix, loop diuretics, furosemide, they can cause metabolic alkalosis, or any kind of endocrine disease like Cushing syndrome, hyperaldosteronism, all are causes metabolic alkalosis. So if I make it easy, so in case of diarrhea, metabolic acidosis; in case of vomiting, metabolic alkalosis. If patient have a metabolic alkalosis, patient usually complain of decrease the respiratory rate and depth. Patient complain of dizziness or hypokalemia. Whereas the metabolic acidosis, patient develop hyperkalemia, means potassium level increase. But metabolic alkalosis, patient develop hypokalemia, means potassium level decrease. Or also patient sometimes complain of paresthesia, means abnormal sensation or numbness or tingling sensation. If you not give them treatment, patient develop tetany or tetany, anyone. So when patient have any kind of metabolic imbalance or respiratory imbalance, we always check for electrolyte balance. So